Hi, my name is Allison Slazik. I am a nursing student here at South, and today I will be demonstrating how to properly administer injectable heparin. So whenever you're preparing any type of medication, you want to make sure that the medication room door is closed, and you want to limit distractions, no phone use, and limit the amount of conversations you have with your colleagues unless it pertains to the medication you're preparing. So to begin this, we're going to compare the patient care order form with the medication administration record. So first we're going to look at our patient. We have Jaguar J. Jones. Jaguar J. Jones. Date of birth, we have 8/25/1963. 8/25/1963. The MR number, we have 4176352. 4176352. Now I see we have an allergy to penicillin and an allergy to penicillin. Now we're going to go ahead and look at the actual medication order. So we have heparin. 5,000 units, 5,000 units, subcutaneously, every 12 hours, every 12 hours. Heparin is an anticoagulant, meaning it protects people from blood clots. And there are all the elements necessary for a legal medication order. So we are now done with the patient care order form. We're just going to be using the MAR. I'm going to go ahead and perform hand hygiene, and I'm going to grab my heparin vial. So this will be the first check for our 7 rights of medication administration. So our patient, we have Jaguar J. Jones, and looking at the medication order, we have heparin and we have heparin. We have 5,000 units. Now the vial is 10,000 units per milliliter. So we'll be drawing up half a milliliter to account for the 5,000 units in the order. This is a subcutaneous injection. So we'll be using a tuberculin syringe. This medication is to be given every 12 hours. Mr. Jones has not received heparin within the past 12 hours, so he is due for another dose. Heparin is an anticoagulant, meaning it protects him from blood clots, and this order has all of the elements for a legal order. Now, looking at the vial, the expiration date is 12/5/25, so it is not expired and it is okay to use. Now I'm going to go ahead and take a clean alcohol pad, and we're going to clean off the top of the vial. Throw that away. Now we have our tuberculin safety syringe, which is 1 milliliter. Going to go ahead and take that out. So I'm going to insert some air. I'm going to carefully take the cap off, stick the needle in, inject the air, flip, and we are going to withdraw half a milliliter. Okay. Now I'm going to carefully recap. And we have half a milliliter of heparin. Now, for our second check for these 7 rights, we are going to use the syringe, the vial, and the MAR. So our patient, we have Jaguar J. Jones. For our medication order, we have heparin. We have heparin in the vial, and we use the vial to withdraw the medication in the syringe. We have 5,000 units. The vial is 10,000 units per milliliter, which is why we withdrew half a milliliter with the syringe. This is a subcutaneous injection, so we use the TB syringe for that. This medication is to be given every 12 hours. Mr. Jones has not received heparin within the past 12 hours, so he is due for another dose. Heparin is an anticoagulant, so it protects him from blood clots. And this order contains all the necessary elements for a legal medical order. So I'm going to go ahead and make a label for my syringe so I can take it to Mr. Jones's room with me. And I'm going to go ahead and write the patient name, the medication, and the medication dose. So we have Jaguar Jones. We have heparin. And we have 5,000 units. So I'll be putting this on the bottom half of the syringe so it does not interfere with the dosage. All right, so I'm gonna go ahead and bring my vial, my syringe, a clean alcohol pad, and my MAR to Mr. Jones's room. Hello, Mr. Jones, my name is Allison, and I will be your nurse today. I will be administering heparin. So I'm going to go ahead and do a couple checks on you. First, I'm going to perform hand hygiene, and I'm going to raise the bed to a level where it's comfortable for me to work at, and I'm going to lower the side rail. If I could see your wristband, this is the armbands, which obviously, okay, anyways. Now I'm going to go ahead and do my third and final check for the 7 rights. So I'm going to be using the syringe, the vial, and the MAR again. So, as well as the patient wristband. So we have Jaguar J. Jones. Jaguar J. Jones. Date of birth, we have 8/25/1963. Date of birth, 8/25/1963. MR number, we have 4176352. MR number 4176352. I see you're allergic to penicillin, and your allergy wristband would confirm that. Do you have any other allergies that I need to know about, Mr. Jones? Okay, and before I administer this heparin, I would assess your PTT lab values and assess your risk for bleeding. And okay, now I'm going to look at the syringe and vial and compare it to the order on the MAR. So we have heparin on the vial, and we have heparin on the label on the syringe. We have 5,000 units. On the vial, it's 10,000 units per milliliter, meaning we would need half a milliliter. And this is half a milliliter. This is a subcutaneous injection. So that is why we are using tuberculin syringe. This is given every 12 hours. Mr. Jones, you have not received heparin within the past 12 hours, so you are due for another dose. Heparin is an anticoagulant, meaning it prevents you from getting blood clots. And we have all the elements here in the medical order for it to be a legal medical order. That is the last of the 7 rights. So I'm going to go ahead and put my gloves on. So we are now ready to administer the heparin. So since this is a subcutaneous injection, we're gonna go ahead and first of all put our glasses on. Then, since this is a subcutaneous injection, we're gonna go ahead and use the abdominal site. So it'll be at least 2 inches from the umbilicus. And so what we're going to do is first I'm going to assess the skin and make sure there's no bruising. And I don't see any bruising. I'm gonna go ahead and clean in a circular motion. Okay, go ahead and throw that away. Now I'm going to uncap the needle. I'm actually going to put this right here before I threw that away. Obviously that's not sterile, but we wouldn't do that in real life. Okay, so I'm going to go ahead and pinch Go in at a 45 to 90 degree angle and slowly inject. Now we're going to take it out, immediately put it in the sharps container, and put the alcohol pad over the site in case it gets to bleeding. Hold for 10 seconds. Now I'm going to throw it away. I'm going to take off my gloves, glove to glove, skin to skin, into the trash. Perform hand hygiene. Now, I'm going to put the bed back down to the lowest level and raise the side rails. Make sure Mr. Jones is comfortable and has everything that he needs. I'm then going to go and document if he had any allergic reactions to the heparin, as well as how he tolerated it, and document that I actually did give the heparin. And that completes my heparin administration.